Thank you. I'm Sarah Tadia. I'm the Operations Executive for Freo Street Doctor at Black Swan Health. And I'm delighted to be here this evening to present to you the opportunity to support those most vulnerable people within our community by providing them access to professional mental health services. So I hope most people are familiar with Freo Street Doctor. We've been a part of the Fremantle community for more than 14 years. Freo Street Doctor is a non-judgmental, accessible, free medical service for homeless, at-risk and marginalised people within our Fremantle community. Freo Street Doctor is a vital service. It's a critical service. It fills a gap to support the physical health needs of these most vulnerable people. We're really proud to run Freo Street Doctor. We're proud because we do really good work. But there's more that we could do, and we know there's more that we could do. There's another gap in vital health services, and it's really impacts hugely our clients and many, many clients with mental health illness, access to mental health services. So Tim is a Freo Street Doctor client, and when we spoke to Tim, he was 30 years old and he was living on the street. Tim had been suffering from mental health illness for many years, and he was unable to access basic services that would help him manage his deteriorating mental health. He felt isolated and he felt alone. And these are Tim's words. I went to the hospital. They basically said there was nothing they could do. They sent me away. I was not in a very good mental state. I couldn't really do much for myself, and I had nowhere to go. So Josie's another one of our Freo Street Doctor clients, and she was 32 years old and living in a refuge when she spoke to us. Josie felt isolated from the community. She felt unsupported, scared, and unable to access the services that she needed to support her physical health and her mental health. She felt rejected, and she felt powerless to get out of the situation she'd found herself in. This is what Josie told us. That feeling too, when you're homeless, it's very hard. You feel isolated, and you feel that you're not part of the community anymore. So going to a normal clinic is a very difficult thing to do because it's not something you can get out of straight away. You feel rejected by the community, by society. Having a mental health illness makes it hard to access healthcare, social services, and even to manage your life. But when you're already in a vulnerable situation, it becomes that much harder. Our clients struggle to access mainstream health services such as GPs, let alone trying to access mental health services. We know that if we can support our clients to address their mental health, it'll make it easier for them to manage their complex and chaotic lives and their physical health. When your mental health is better managed, it's so much easier to take your medication regularly and to reconnect with your family and your friends and your community, and actually to look after your physical health. And one of the main things about being able to look after your mental health is that it just gives you that opportunity to have those really hard conversations, and it's always a really hard conversation when you start that journey to recovery. So Freo Street Doctor provides medical care to thousands of people each year, the majority of whom struggle with untreated mental health issues. And we estimate approximately 80% of our Freo Street Doctor clients require professional mental health services. The Freo Street Doctor is well known within the community and it's trusted by our clients, and they tell us that they need health support, and in their eyes we are the best place to get it. These people are vulnerable, which means they're physically, mentally and emotionally exposed to harm, and they require special care and special support. And Freo Street Doctor provides that care and support. And equally important to our clients, Freo Street Doctor provides them with a safe place. At Freo Street Doctor clinics, our clients can talk to people, other people in their situation, people in our team, or people from the other service providers that we work so closely with. For 3 hours a day, they can be part of a community. They can belong somewhere, and they can matter to someone. A recent study by Notre Dame University and UWA has provided us some amazing insights into Freo Street Doctor. But one of the most important ones is something that we've long believed, and our clients have confirmed. The published research states, outside the Freo Street Doctor clinics, life on the street can be isolating. The Freo Street Doctor waiting room, which is just the area surrounding the vehicle, is described as a positive and safe environment where patients could talk to each other and share information to help each other's circumstances. This was particularly so for those living on the street who felt vulnerable and at risk of assault and theft. Freo Street Doctor provides somewhere to be safe, somewhere you don't have to hide the life that you live, and somewhere to belong. So you can see, we do good work, we make a difference, and we give people a sense of belonging. But we could do better work, and we could start to make a bigger difference and give Josie and Tim and all of our other vulnerable clients access to the vital mental health support they need and that they should have the right to access. As a mobile medical service, Freo Street Doctor does reach those most vulnerable people. We make ourselves available in their environment where they feel comfortable. And people who access mental health services are often homeless or marginalised, suffering from multiple chronic conditions and mental health issues, and tend to be frequent users of hospital emergency departments. With direct access to mental health services, our clients will be able to get the mental health support they need sooner, before they reach a crisis or before they need to engage with an emergency department, or worse. Our clients have complex medical histories and complex medical needs, often presenting with 2, 3 or more significant health conditions, not just the one like most of us experience. Our wonderful GPs provide a physical health care to as many people as possible at each clinic. But that also means that they don't have the capacity to address people's mental health care needs. We know that if we can provide access to mental health services for our clients, their health outcomes and their social outcomes will greatly improve. But we know that it's hard for our clients to link with mainstream health services. Our clients tell us how Freo Street Doctor works in filling the gap in access to physical health care. So why wouldn't we apply these learnings and this proven approach to filling the gap in access to mental health care services with the Freo Street Counsellor? We put a mental health counsellor where our clients are. We make it free, we don't take appointments. We make a culturally safe environment. Currently 38% of our Freo Street Doctor clients are people who identify as Aboriginal or Torres Strait Islander people, and that's compared to 2% in mainstream general practice. And finally, we use the amazing skills of our team to provide service to people that is non-judgmental and respectful. So we've worked really hard on making Freo Street Doctor a financially sustainable service, and we will bring that knowledge to the Freo Street Counsellor service. And it's not going to be easy, but it is going to be worth the effort. Our clients deserve support for their mental health issues. Let's repay the trust that they have in us and fill the gap. So the Impact100 grant will allow us to set up the Freo Street Counsellor service and provide 2,000 hours of professional mental health support for our vulnerable clients. The grant will support the wages for the mental health professional and an outreach worker, let us purchase a portable soundproof room and furniture and promote the service. And we will bring our skills in implementing sustainable programs using the grant to establish a service that empowers clients to move into structured mainstream mental health services funded through Medicare for many years to come. But we need you. We need you to help us get this started. We need you to help us make mental health services accessible to the most vulnerable and disadvantaged people in our community. People like Josie and Tim who desperately need mental health support. We need you to help us give our clients the opportunity to address their mental health issues and consider themselves a part of the broader community, and we need you to help us give our Freo Street Doctor clients a direction towards a different life. Thank you.